CIRS is an acronym for Chronic Inflammatory Response Syndrome. I want you to pay attention to something chronic. It means that it will affect you the rest of your life. But here's the great news. Your body can move into a state of balance. CIRS affects multiple parts of your body, your immune system, your hormone or endocrine system, and your neurologic system. So when a medical practitioner or you determine that you have chronic inflammatory response, it means that a domino effect has occurred. In your body, number one, your immune system is affected. That's intimately tied with your neurologic system, your brain, your cognition, your emotions, anxiety, panic, depression, fear. But your hormone system can be out of balance too. So when you partner with a medical provider, number one, they need to determine if you have a genetic predisposition for chronic inflammatory response. The reason you're receiving this video or you've enrolled in this course is that we've either determined that you have that genetic vulnerability or you may not, but a master control hormone in your body called MSH, melanocyte stimulating hormone. It's like an orchestra director that controls many areas, influences many areas of your body that cause many different seemingly unrelated symptoms.